Bill Kintz. By profession, I'm a social worker. I'm vice president of a major social service company. I'm 69 years old, and I'm in fairly good health. Several years ago, I went to a cardiologist to look at a possible heart murmur, which turned out to be normal, but in the process, it was determined that one of the causes of any problems I may have had was due to possible sleep apnea. I went through a sleep apnea testing, and it was determined that because of a recent lost weight, I had obstructive apnea. I was then advised to be fitted for CPAP. I did not tolerate a CPAP, and I elected instead to opt for a dental orthotic, and I was referred by my sleep doctor to Dr. Kanehl for a dental orthotic. I had read a little bit about these appliances and felt that this was a less intrusive way and probably a much better way to help me sleep and maintain my own personal regimen. So about 3 months ago, in May, I went to see Dr. Kanehl, and I was very impressed with his chairside manner. He informed me about the procedures, a little bit about the history, was very informative, did a great deal of patient education, which I thoroughly enjoyed and appreciated. He then fit me after a thorough dental exam. He did impressions of my mouth, and within a week or two I was fitted with a dental orthotic. I can tell you very, very candidly that it has been very effective. It has been not at all intrusive for me, and it has actually improved my sleep. I now have good REM sleep. There are times that I have a little bit of discomfort, but I've been able to adapt to it quite nicely. But I'm really happy to give this testimony on behalf of Dr. Kanehl and his associates, feeling that whatever I have to offer, whatever encouragement I have to other patients who might opt for an appliance like this, that I can, without reserve, give my endorsement to this